Are you someone that deals with sleep and chronic back pain? Back pain and chronic back pain end up becoming a big problem. It creates a lot of stress and anxiety for a lot of people. You see that stress and anxiety is a question that people always ask, why do I have stress? Why does anxiety make my pain worse? And the reality is the body has two systems. One is called the sympathetic system. That's your flight or fight response system. And the other one's called your parasympathetic system. That's going to be your relax and digest and rest system. The sympathetic system is built through your body and your nerves to help you basically run or move quickly. And it prepares your body for a sudden burst of energy, adrenaline, and as if you're being chased by a mountain lion, you need to move fast. On the flip side of it, your parasympathetic system balances out the sympathetic system by giving you an opportunity to relax and rest and recharge. Sleep is a very important part of the parasympathetic system because that's the time where you spend, 8 hours ideally resting, digesting, and preparing for the next day. And when that parasympathetic system is not on well, the sympathetic system essentially is on more. So how do we balance those things out in relation to sleep? Well, I'm going to give you some tips about sleep today and how to position your body so that way you can get that parasympathetic system in check. If you don't have it in check, what ends up happening is your body starts to use the sympathetic system more in your day-to-day activities, and that ends up becoming the predominantly used system in all of your things. So an example of that would be if you're at home at 6:30 at night after dinner and you want to relax but you're still wound up, and then on top of it all you have a late night coffee with caffeine in it, or you have some stress, or you get a bad phone call from somebody that you don't want to talk to, and then you're ready to go to bed and it's 9:30 by that point and your body can't wind down. On the other side of it too is if you don't have the sympathetic system working well to charge yourself up for certain things, and you're not prepared either. So you want to have a good balance of both, but when it comes to sleep, the parasympathetic system is king. All right, so what we're looking at here is basically sleeping and sleeping posture. I'm going to give you some tips on how to do this better. Remember, what we're trying to do is we're trying to take the parasympathetic system, which is the rest, relax, and digest system, and engage it more. And one of the best ways of engaging that system is to find a really good position to sleep in that relaxes your muscles. Remember, muscles that are tense and not relaxed are going to be more toward pain than not. Some people are tense in general and could hide their pain well, but if you're under pain and you're tense, it's going to be a tough time for you to sleep, and you do need to sleep to recover and relax. So the first tip is obviously, I'm just going to take this pillow here and put it in a certain position, and we're going to start off with just the position of the pillow under the hips. Your position is going to be laying like this essentially, and you're going to have a pillow here for the point of relaxation. Now, in addition to this, right, as you get your pillow under your hips, a lot of times people forget that a very important part of your general ability to relax is your breathing. So as you're laying down in this position and you have your head in a comfortable position, you could always start your breathing process by doing nasal or nose breathing in and out through your nose. So the simple thing is just people will ask all the time, do I need to do like 3 seconds in or 4 seconds in or etc. There's many ways of breathing. There's different methodologies of it, many books written on the proper ways of breathing. The main thing is to breathe through your nose and engage your diaphragm muscle, which is right here in the middle of your body. And as you put your hand over your belly and you breathe in through your nose, you want your hand to go outward like this. So it's breathe in. So as you breathe out through your nose, your stomach will flatten. And when you breathe in, your stomach will expand out. And that's a real important thing because once you start doing that, some people may even feel a little rumbling in their belly, like almost like a digestive kind of thing, or they'll feel just relaxing because they're getting their diaphragm, which is a very big muscle that coordinates breathing, to start to engage in the process of relaxing and decreasing. And that muscle actually attaches to your ribs and attaches to your spine in a way that'll help you relax those muscles also. And you're just generally getting your body to relax more. So that's one position for your hips. The other one is between your legs. So here in this position where your pillow is between your legs, your legs and your spine are in a neutral position. The spine is actually more straighter and in alignment. And when the spine is in alignment, what happens is all the muscles that are around the spine get to relax more because they're in a better spot and there's less pressure and there's more decompression of that spine. And when that happens, the nerves relax and you engage more of your parasympathetic system than not. So you want to be in these two positions if you can. And people ask, can I do a pillow here and a pillow down there or vice versa? It really is a matter of comfort, but the most important thing is any position you're in, start to engage in that breathing to really incorporate how you're going to relax as you get into the position of laying down. Some people aren't side sleepers, so that doesn't help, but you can still do this exercise very well before you lay on your stomach or you lay on your back as you're resting. You can do it on the other side as well to get your spine engaged on both sides. It's a simple exercise to do if you want to consider it, and I consider it an exercise because of the breathing thing. And if you want to do the breathing part of this, I would just say for a few minutes, just take it easy and do it, relax, wind down, and then you'll get your body to relax and be in more of a meaningful alignment for your spine. And then that ultimately helps you relax better and can contribute to an improvement in your discomfort over time. So remember, sleeping is a really, really important thing for you to get yourself down-regulated with the parasympathetic nervous system and relax and rest and finally digest. These are really important aspects of how you wind down through the course of your day, and it's not a one-time thing, it's done every single day. So using these tips, you'll find that your positioning for your body will be better, and ultimately, if your pain is reduced and you feel a little lighter in terms of that, you'll ultimately recover better and improve. So those are my tips for you on sleeping. I'm Dr. Vinod. If you like my content, hit the like button, subscribe, and the notification buttons for future content. See you next time.